Hi, good afternoon, everyone. Can you hear me?
Yes, good afternoon.
Okay. Sorry I'm late. I was just celebrating my mother's 65th birthday. Sorry, I'm just getting here. And so my name is Harriett Oppenheim, formerly Harriet Johnson. And I'm here just to talk to you all about, from a patient's perspective. I'm actually a kidney transplant patient. And my experience as a black female who was on dialysis for 3 years. Just to give you a little background, Mississippi is the state with the highest number of people who have kidney disease. Number one, who are on dialysis. Yet we only have one transplant center here, which is the University of Mississippi Medical Center. And unfortunately, that center doesn't do many transplants. I actually myself stayed on dialysis for 3 years, unable to get a transplant at UMMC. So I had to go off to Nashville, Tennessee at Vanderbilt, where I received my transplant. There's also less encouragement for medical providers to give transplants because it's about business here in Mississippi and America. It costs $85,000 per year to keep me on dialysis. Yet, while a kidney transplant, it only costs my medicine me about $10,000 a year for a person who has a transplant. They keep more people. It's more of a profit to keep people on dialysis than it is to actually get them life-saving measures of having a transplant. What's more alarming is that black people make up most of the people who are on the transplant list. However, most of the people who receive transplants are white, older people. Even in my experience at Vanderbilt, I was one of only maybe about 30 people in that transplant unit. I was the only black person who received a kidney transplant. The rest were white, older people. And so, seeing this pattern, I'm here to speak on behalf of people, my fellow dialysis patients who are still on dialysis, who don't have that kind of voice to reach out and tell you all what's happening. What's happening is that they're not encouraging transplants. They're not especially encouraging transplants for black people. And especially when our state failed to expand Medicaid, that further, hinged the effort to get more transplants, because that money would have enabled to allow UMMC to hire more doctors who do more transplants, would have put education out there, because while my lupus led to kidney failure, a lot of people, kidney failure is because of high blood pressure. It's because of diabetes. We need to be educated more. But of course, that is not profitable. It's more profitable to keep people, especially black people, sick. And so, just unfortunately, I am fortunate because I do have federal benefits, and I was told, there are rumors, but I'm pretty sure that's true, that if you do have private insurance, you are more able to get a transplant easier because they know their private insurer will pay. Whereas most people on dialysis only have Medicare. And ironically, most of the people who I was on dialysis with, the ones with private insurers, receive transplants. The ones who have Medicare, 9 times out of 10, they're still waiting for a kidney. And so I just see this pattern, and it's sad. It really is sad because profit is more important than health.